in with departments nowadays? Like, are they doing this proactively or are they reacting after a critical incident or a loss?
Well, there there are reactive situations, obviously, after critical incidents where we get more people reaching out to us, either to talk to one of our peer supporters that will chat with people online, or maybe they're looking for a mental health resource in their own city, in their own community, which we will also provide uh, those referral sources. Um, as a little side note, I'm super impressed with what you guys are doing to help first responders with the cost of seeing a mental health professional. That's not something that we have been able to do. Although our board has had conversations about doing something similar to that from time to time, but um, the revenue that we generate is not really sufficient to support that. So it's good to know that when we were making those referrals, that if people prefer to find other funding sources rather than to use their department insurance or see their EAP provider or whatever it is, that there are resources out there to help them do that. So we get a lot of reactive response after incidents, but one of the things that I've noticed, and when I travel, I try to find out what's going on in those communities, and I've seen a shift where I would say, back when we first started this program, the majority of departments were, box checkers, right? They would say, okay, we've provided this training, check that box.
Yep.
We've got a pamphlet that we hand out to officers that says, here's how to contact the EAP. We check that box, right? Um, what we've been seeing over the last 3 or 4 years, and I think a lot of this is post COVID, when people began to realize just how stressful it was to operate under those conditions for an extended period of time, that more people were just, to use the colloquial term, stressed out. And so I think the shift has been toward legitimately uh, trying to provide more mental health and overall wellness resources for the department. I think some of that is driven too by younger officers coming in who are less concerned about being transparent, showing a little more vulnerability, if you will. So I think as we see um, the transition in departments over time, where we have retirements and younger people coming up into leadership positions and younger officers coming into those agencies, I think we're going to continue to see a transition toward more openness, more transparency, more vulnerability, more willingness to have conversations without the fear of the typical stigma that has always been attached to having those kinds of conversations.